I think that certainly knowing that June is a time where we inform and educate our communities and also talk about the importance of brain health and bringing, certainly tools and strategies to our families. And today is really for all of our community members to be able to best understand how to recognize the 10 warning signs of Alzheimer's. So you will certainly experience a series of educational strategies, videos, really good teaching tools for families to learn more about. Please place your questions in the chat, and we'll be very pleased to be able to address any questions that you may have. This is one of our basic programs of the Alzheimer's Association. Excellent information to share with all families. So with that, I'd like to introduce our community nurse educator, Debbie Montone, who will be presenting and delivering this program, and both of us are available to answer any questions that you may have. Thank you so very much for joining. Debbie.
Thank you, Robin, and so nice to see all of you. The 10 Signs is probably one of my favorite programs. It was like when I went to nursing school, and every time we talked about a different body system and all the diseases in it, we were convinced that's what we have. So as we go through the 10 signs, I know that, a lot of people will go, oh, but I have that. But there's a difference, and that's what we're going to go over. I've been working with the Alzheimer's and dementia population for many years now, everything from assisted living to a dedicated unit to my favorite, which was a daycare for people with dementia and Alzheimer's. So I try to bring some of that experience into each program. And I do facilitate a number of support groups, memory cafes, and the like. So let us begin with these 10 warning signs. So what we hope to accomplish in this hour or so is to describe typical age-related memory, thinking, or behavior changes, and recognize what will be a common warning sign of Alzheimer's or dementia. And we will discuss tips for approaching someone about memory concerns. You just don't want to be blunt. There's a proper way of doing it. Explain the importance of early detection and benefits of diagnosis, and identify possible tests and assessments to diagnose what or if someone has Alzheimer's and dementia. And finally, to name the resources that are available through the Alzheimer's Association. So we're going to meet the Garcias. This is a family that we're going to follow throughout our 10 signs. Mary is a 73-year-old widow. She lives alone. She is a retired teacher who has always been meticulously in the way she cared for her home. Her daughter Lydia has recently been noticing laundry's been piling up, junk mail and old newspapers are just lying around, and that's not her. So she's going to have a conversation with her younger sister, Patricia. So let us take a look at that conversation. Worried about Mom. She keeps losing things and the house is a mess. Well, probably normal to get a little forgetful with age. It's so unlike her. Should we worry? Let's reach out to our old neighbor, Dr. Salloway. Dr. Salloway is a real doctor who does work with the Alzheimer's Association.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning or what might be the beginning of a memory problem is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
Okay, so we are going to start and take a look at those 10 signs. And we will start with what is dementia, what is Alzheimer's, and why is it important to know the signs? So let us go to first one. What is dementia?
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
All right, so you can see that umbrella. That umbrella represents visually dementia. Dementia is a symptom. All of those diseases underneath that umbrella, they were diseases that exhibit the symptom, which we call dementia. So one's a disease and one's a symptom. Okay, next.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Okay, so why it's important to know these signs. Let's take a look at that.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor to find out what you're dealing with.
Okay. So we're going to take a look at each one of those warning signs, and we will talk about what pretty much is normal, not normal, and ultimately we'll talk about what to do after. So our first sign has to do with memory loss that disrupts daily life, and that is kind of a clue. One of the most common signs, in fact, is forgetting recently learned information, something we just heard, 5 minutes, 10 minutes, even an hour. So that's one of the most common signs, is forgetting that. Other things include important dates or events. Grandchild's birthday is next Sunday, and you completely forgot. Another sign of that is asking the same question over and over and over. And maybe you've experienced that, and maybe you don't quite understand why. Well, it's because the person does not remember that they asked the question, and more important, they don't remember the answer that you might have given. And that's certainly one of the reasons, they just don't remember anything short term. Another sign is increasingly relying on memory aids, little notes and stickies, or a board that tells you, what's to do or what's happening. And certainly, without the board, you wouldn't be able to do it. But let's talk about what's typical. Listen, sometimes we forget things. We all forget things, names, appointments, but the key difference is that we do remember them, maybe a little bit later, but we remember them, and that's what makes the difference. Okay, next one, please. Challenges in planning or solving problems. So let's take a look at this sign. Some people may experience changes in their ability to develop and follow a plan, or work with numbers, or anything that they've had to develop. We kind of call that executive functioning. And one of the things you might notice is they cannot follow a familiar recipe. Or, and really common, they cannot keep track of their monthly bills. If anybody is checking, either they didn't pay them or they paid them twice. And, it certainly creates quite a problem. And thirdly, difficulty concentrating and taking much longer to complete a task. And not to say, we take a little longer because we have the time or whatever, but you can't concentrate. That's the big key there. And so, you're trying to remember the steps to do what you're trying to do. So that's certainly the challenge in this step in planning and solving problems. We lose that ability. Okay. Let's see what the sign is for John.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
So let's look at the next one. Difficulty completing familiar tasks, something that you've been doing on and, over and over again. So with this sign, generally people living with dementia commonly have difficulty completing a daily task, such as driving to a familiar location or organizing a grocery list. And, we all know your supermarket, what comes first and then after, and you kind of organize it like that. But with dementia, you don't remember the order or how to do that. And then finally, remembering the rules of a favorite game. When I was in the daycare for Alzheimer's and dementia people, we would, in some part of a day, have a game, bring out games, and they, gave them 2 options, and they wanted to do this one. Oh, yeah, I know how to do that. We get it all set up, and unfortunately, everyone remembered different rules. Well, that's not the way I played it, and until we had to settle on a way that everyone was happy with, because nobody really remembered the real rules, and that's what happens. What's typical for age-related? Needing help to use the settings on a microwave or to record a television show. And I don't know about you, but I have an issue with remotes. I don't understand, they should all be the same, and I don't understand why some TVs need 2 remotes. So, that's normal, but it still annoys me. All right, let's see what we are doing next. We're going to hear from our expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Okay, so true. So next one, confusion with time or place. And so with this sign, people living with Alzheimer's or other dementias, they lose track of dates, seasons, the passage of time. You ask them what season it is, it's winter. Well, we know it's not winter, but they think it's winter. What time, morning, afternoon, they just really lose track of that. And so another sign would be understanding something if it did not happen immediately. Like they can remember maybe right this second, but anything before that, they really have trouble remembering. And forgetting where they are or how they got there. And I'll tell you a quick story. At Thanksgiving, we had a relative of my daughter's there on the other side of the family. And we were just all sitting, and all of a sudden she came out with, "How did I get here?" I was like, she just didn't remember how she got from her house to this house. And, it's scary for everybody, and then, we told her, and hopefully I think she remembered for that second. So, these are real signs. You think that, no, it's not, but I have definitely, seen many of these, and this was one of them. What's a typical age-related change? Well, getting confused about the day of the week. All right, now how many of you have woken up going, what day is today? All right, but we do figure it out a little later, whether we look at the calendar, the newspaper, the TV, my phone, we figure out, and we know how to find what day of the week it is. So, that's a good thing. And we will look at the next sign. Trouble understanding visual images and spatial relationships. And with this sign, some people have vision problems, and that is a sign of dementia. Now, we know that vision problems also are associated with other things, so don't anybody panic yet. But people who do have vision problems, they have difficulty with their balance. They have trouble reading. They have problems judging distance and determining color. or contrast, which causes issues with driving. Just think of stop signs and traffic lights and, things that use reds and greens. And a lot of these signs, if you think about it, determining, judging distance and things like that, has to do with driving. If someone is still driving and they have this sign, you need to judge a parking spot. You need to judge turning the corner without going over the curb. And these are spatial relationships. And, if you have lost that, that is certainly a sign. Now, what's typical? Vision problems, cataracts, glaucoma, macro degeneration, sometimes medications so there's many things that can be typical and age related. But let's hear from our expert as to what they think.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Okay, so true. Number 6, new problems with words in speaking or writing. And this is certainly a sign of someone with dementia. Maybe they're talking and they stop right in the middle of the conversation because they don't remember what they were talking about. They have no idea how to continue. And so they stop, or they'll start all over, repeat, and then stop. They struggle to find the right word, vocabulary, and they have trouble naming a familiar object. They use the wrong term. A stapler could be a hairbrush. And so, that certainly is something that they do. Now, when you start to remember what it is, great. I wanted to say something about the words. Some of the people that we had in our daycare, you spent so much time with them, every day with them. And as time went on, you could see them struggling to find that word. They'd be in the middle of telling you something, and you want to help them, like, all right, what were you talking about? You look around, trying to figure out what was going on right before they stopped. If you're eating lunch, well, did we just give out dessert? Did you want a different dessert? It breaks your heart watching them trying and struggling, and they can't come up with the right word, which, is different than ultimately coming up with the right word. So let's see what Phil has to say, what his sign is.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Okay. Next one, misplacing things and losing the ability to retrace steps. And with this sign, most of us, we lose our glasses, our keys, phones, but we think a few minutes, okay, I was here, I put the phone down, and then someone called me, and you can go back and retrace your steps. The difference is you lose something and you can't retrace your steps, or you put things in the most unusual places. I think there was a commercial where a wife put her keys in the freezer with the ice cream, and that's not a normal place for keys. And they were looking all over for it, and the husband found it there. And that's typical. That commercial really said exactly what's happening. You can't remember the steps that you took as to where you put them, which most of us can go back and retrace our steps. What happens with this step is we accuse others of stealing, and it gets more frequent as time goes on. I used to see this when I was at the assisted living. People would accuse somebody, "You stole my sweater," right? There was no proof of anything. And, there are times you know that nobody was in there, and there are other times you have to decide. But, they accuse people of stealing, and then they get mad if family comes. "Well, why aren't you helping me find it?" And, these are things that, will start to happen. So what's typical? As I said before, we misplace things from time to time, but we have the ability to retrace our steps and find them. And so we're going to hear from our expert again.
So some people wonder if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is, for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, and they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, "Oh yeah, the phone was ringing when I came in the door. I put down my keys." The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Okay, next. Our next sign has to do with decreased or poor judgment. And with this sign, people with poor judgment and decision making, a lot of times we see this when we talk about money. And this is a time where family have to worry about, are they paying bills over and over? Are they being shammed with people who realize that they're a senior, and they send you a call and ask for money, and you start to see people's money go. And the other part of this is people don't pay attention to how they look anymore, or how they smell anymore. Really, they do pay less attention to grooming and being clean. So what's typical? Well, once in a while we make a bad decision, like neglecting to change the oil in the car. My car now tells me it's time to take it in for service. We'll make an appointment. But, mostly these are the kinds of things that, people, that happens to people. We just forget. Let's hear from Teresa and see what she says about this.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Okay. And next, withdrawal from work or social activities. And a person that is living with dementia, over time may experience changes in the ability to hold or follow a conversation. They can't keep up with the concepts, the content of what people are talking about. And, after a while, they get embarrassed, and so they kind of withdraw from these activities, find them sitting in a corner somewhere. We actually found that certainly in the daycare, we were trying to encourage them, just sit here, because we didn't want anybody sitting in a corner, but you have to understand why. And that, they know that they can't follow, even sports. Try some of these, there's all these playoffs now, and, fast, and they can't follow what is happening. So they tend to withdraw from that as well. What's typical? Well, sometimes as we get older, we really don't want to see the family that much, or we don't want to go out and have social engagements like we used to. Of course, in the last couple of years, we had our pandemic, and people were very reluctant to go out and, have a social engagement. And we certainly found a big effect on our peoples with Alzheimer's and dementia, just lack of social engagement, and it kind of didn't get any better. Number 10. Oh, we hear from our expert.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
Okay. Next, changes in mood and personality. And with this sign, people do often get these personality changes. They get confused, suspicious, or fearful, or very anxious. And they get easily upset with friends, and they really get upset when they're out of their comfort zone. So, these are signs of dementia. What's normal is, we all now have specific ways of doing things. And if someone tries to help us and it's not done your way, people become very irritable. And, that is fairly normal. We like the towels folded in a certain way. So, these are very typical signs. So next, let's see.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
Okay, next. So what we're going to look at next is take a look at the 𝐩𝐫𝐨𝐫𝐞 and look at what they're saying. And they're going to be talking about how to interpret the signs and decide what the next step is. So let's take a look. Did you look at the warning signs info I sent? I did, but still don't know. Mom's showing a couple of signs, but not all the time. Well, how do we know if it's serious enough to see a doctor? Well, let's check with Dr. Salloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, you know, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check up all the boxes.
Okay. So let's recap these 10 signs. They are a guide to identify problems that may be related to Alzheimer's. Individuals may experience one or multiple warning signs in various degrees, but they don't have to experience all of them, and you don't have to experience them all to be concerned. You could just have a couple. If you notice any of these signs in yourself or someone else, it's really important to see a doctor. Okay, so we're going to talk about the importance of early detection. I know a lot of people say to us, I don't want to know any earlier than I have to. But let's hear and see. Let's see what Mary noticed, because family and friends are usually the first to notice something is different, something's not quite right.
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, you know, if they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, you know, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was all adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
Okay, so what should you do if you notice changes in someone? Good question. So we have a 10-step approach, kind of like a roadmap to approach memory concerns. So we're going to take a look at that. And we're going to start with, what changes in memory, thinking, or behaviors do you see? So you want to note that. I always recommend to people, get a notebook, little notebook, and write down things that you see, the date, the time, what was going on. Because when you have to go to a doctor and you want to explain why you're there, this little notebook will definitely help. So look for what changes in memory, thinking, or behaviors. Next. What else is going on? Right, and what we, want to take a look at is, is there stresses, new stresses, diseases, diabetes, medication, what else could be affecting that? Number 3, you want to learn about the signs and the benefits of early diagnosis. Right, and has anyone else noticed the changes? Are you the only one, or did other people who have, been together, have they noticed the changes? Next. Now it's time to have a conversation. And by that, we want to have a talk with the person to discuss your concerns. And, you really have to prepare for that talk. Who's going to do it? You don't want to gang up and have the whole family there. Pick 1 or 2 people if there's so many, and, 1 or 2 people who is trusted, and have that conversation to discuss the concerns. Pick a date, pick a time where your person is more relaxed. Is it in the morning? Is it at bedtime or before bedtime? Or is it, mid-morning? Whatever time, is the calmest and best, that's the time that you should pick. And of course, where are we going to have this conversation? It has to be in a place where it's comfortable, it gives you a sense of comfort, that, it's calm, pick a place like that. Next step. What will you or the person having the conversation say? And that's where you don't have to write out every word, but kind of have an outline of what you want to say, such as, I've noticed, and whatever it is that you've noticed, and, continue from there, but have somewhat of an outline. Your ultimate goal is to go to the doctor. You can offer to go with them, and somebody should go with them. And, that's, a good step to do. The sooner is the better, all right? Don't wait. And, you might have to have multiple conversations. Sometimes that first conversation may or may not go well. So be prepared. You might need multiple. And of course, reach out for support. And that's what the Alzheimer's Association can do. We have a 24/7 support line, 1-800-272-3900. And when you call that number, there's a master's level prepared person who will talk with you, find out what your needs are, look and, kind of in your location, because everything's by zip code, to try and find the resources that will help you. So always turn to the Alzheimer's Association. You want to see a doctor, don't put it off. Yes, maybe you'll need 2 conversations, but you will need a doctor. Now, there are different kinds of doctors, and, most people not quite sure of which one. So I can briefly go over that. A geriatrician is a doctor who has had additional training for diseases and disorders of people over 65. Right? Neurologist is a doctor with additional training to go over, what's going on with your brain and your nerves. A neuropsychologist, in addition to being a neurologist, they also are able to treat or diagnose or take care of psychological problems associated with what's going on in the mind. A psychiatrist is a doctor that, can help diagnose different disorders and provide some support. And a psychologist is a MD with additional training with the mind and the body. Right. Now, 10 steps. That's a nice picture. What are the benefits of early detection? And, you know, people...
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Okay, so, you know, that's really why early detection is so important. So pay attention to any changes in memory, thinking, or behavior. If you see changes that are unusual, take action. Have a conversation. Discuss these concerns with your loved one. It's going to be difficult. We know that. Try that 10-step approach and see if that helps. There are a number of benefits, really, for early detection. It includes the importance of planning for the future. Planning is very important, and it's important for your loved one to do it while they still can have an input. You want to explore treatment options and participate in clinical studies where they are available. Okay, next. Seeking a diagnosis. Test your knowledge. Okay. The question is, there is currently no way to diagnose Alzheimer's disease. True or false? Well, the answer is false. Unlike 1900s, where you had to die and then an autopsy was done, nowadays there's a number of different assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's with a pretty high degree of certainty. We certainly have our scans and our spinal taps that now detect the presence of those plaques or amyloids. Next, please. All right, there are some other assessments and tests that should include a medical history and a physical exam. It will also include lab tests, mental cognitive status tests, brain imaging like MRIs or PET scans, and this cerebral spinal fluid analysis. This is a newer way of diagnosing. A lot of those plaques, they kind of little pieces come off, and you can detect that in the spinal fluid. Next. Okay, so do dementia-like symptoms always result in a diagnosis of Alzheimer's or other dementias? Love the word always. So let's see what they're saying. Appointments have been going well. Mom's handling them okay. Do you really think it's dementia? Guess we won't know until we get a diagnosis, but let's ask Dr. Salloway if it could possibly be anything else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
Okay, so let's recap how to seek a diagnosis. Right, the experience varies from person to person. Something other than Alzheimer's or another dementia could be causing the symptoms, and we heard that from Dr. Salloway. The stigma and misconception about the disease, like believing nothing can be done, you really do prohibit some people from seeking a diagnosis. And it is a misconception. There are now things that we can do. Unfortunately, there is a stigma attached to that diagnosis, which we are trying so hard to dispel some of that by education, education, education. So next. So let's talk about what's next when the diagnosis is Alzheimer's. I call up, I got your voicemail. How'd it go? Call you later when I get home, but the diagnosis is early stage Alzheimer's. Oh no, what do we do now? Doc said Alzheimer's Association offers free resources. Some even help people live well with the disease. We'll call soon, but left the office with some hope, and that's a wonderful thing. Okay, so what kind of resources are available through the Alzheimer's Association? Okay. So our mission, the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And our vision is a world without Alzheimer's and all other dementias. So we are available 24/7 on our helpline. And so if you are really worried, concerned, it doesn't matter if it's 3 o'clock in the morning, you call that number and someone will talk to you and help you and direct you to resources that will be in your area. You could also go online, alz.org, and nationwide, our alz.org/CRF, Community Resource Finder. It is a wonderful part of the Alzheimer's site, and you can get anything. There is so much information on our site about resources and help that you might need. Or are you looking for some kind of housing? Are you looking for a support group? Whatever it is, there's just so much information. alz.org/CRF.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
Okay, so
When I
again,
went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
okay, so again, now we have other things and ways to join the fight. We have walks. You can volunteer, right? We need so many volunteers, whether it be a few hours or more time. Go online and see some of the opportunities. You can join our walks, which are this fall, and be part of a planning committee, alz.org/volunteer or /walk. I did that today. Become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. alzimpact.org. Trial match. Everyone can help advance Alzheimer's research by participating in clinical trials. Get started with Alzheimer's Association Trial Match, a free, easy-to-use clinical studies matching service. alz.org/trial match. And held annually in more than 600 communities, the Alzheimer's Association Walk to End Alzheimer's is the world's largest fundraiser to fight the disease. Register today, raise awareness and funds, and benefit Alzheimer's care support and research. And the walks are wonderful. They're beautiful. Just to see them, never mind being a part of it. And finally, our longest day, which is the day with the most light, the summer solstice. We raise funds and awareness for the care support and research efforts of Alzheimer's. And certainly you can do an activity of your choice, alz.org/thelongestday, all one word.
Support public libraries. Like, share, and subscribe for more great videos.